A lot of people are talking about Ozempic face. You know, the sunken cheeks, the hollow temples, the jawline that looks like it's been aging for 10 years in just 6 months. But here's something that nobody is talking about, but something that I'm seeing in my practice. Ozempic is doing something to your mouth that is quietly setting it up for cavities, damage to your teeth, and bone loss. Now, I'm not anti-Ozempic. I think these drugs work really well for the right people. But if you're on a GLP-1 or you're thinking about getting one, there are 3 things that are happening or going to happen to your mouth that your prescribing doctor is probably not telling you. So let's talk about them. So if you've been on the internet for the last few years, you've probably heard about Ozempic and these other GLP-1 agonists. It's gotten to the point where roughly 1 out of every 8 Americans is on one of these drugs. And the conversation is usually about one of 2 things. 1, does it work for weight loss? And 2, what does it do to my face? So here's the thing, your prescribing doctor that gives you Ozempic is not a dentist. So they're not gonna look at the things that a dentist looks at. Things like your salivary glands or like how your teeth are changing. So today I'm gonna talk over 3 things that Ozempic or other GLP-1 drugs could be doing to your mouth. So the first one is dry mouth, and I'm gonna go over how that can play into getting cavities. The second is acid, and we all should know why acid is bad for your teeth. And the third is bone loss. So first off, a lot of medications can have a side effect of xerostomia. In other words, dry mouth. Now, specifically in regards to Ozempic, there was a review that came out in 2025 in the journal Biology. What they found is that GLP-1 receptors are physically present in your salivary gland tissue. So basically, when that drug binds to those receptors that normally produce saliva in your mouth, it's throwing it out of whack, and now it's not producing as much saliva. And over time, this becomes less responsive. So it's not one of those situations like, I'm dehydrated and I need to just keep drinking more water. You're actively producing less saliva. And actually, there's another case series published in 2023 in the journal Medicine. These are actual documented patients on these drugs showing up with hyposalivation, meaning less saliva flow. Now you might be wondering, what's the big deal if I don't have as much saliva? Well, saliva is like the best bodyguard that's natural for your teeth and your gums. It has a ton of benefits for our mouth. It washes away different food and bacteria. It carries minerals in it that are necessary for our gums and our teeth to be healthy. And it can also neutralize the pH in our mouth. If there's one thing that can damage our teeth, it is acid. And acid below a certain threshold can actually trigger a cavity or a hole to form in your tooth. Luckily, if we have saliva, it can neutralize this. And as people get older, as they start taking more and more medications, they tend to have a lot more dry mouth because a lot of these medications will cause a dry mouth, like I said before. And then one thing we always notice is they start getting more and more cavities. And they're always confused, like, I'm brushing and flossing and having the same diet. Why am I getting all these new cavities all of a sudden? That's the importance of saliva. If you have a dry mouth, you're gonna be at a much higher risk of getting these cavities and gum disease. Now here's the thing, if you somehow dodge the dry mouth problem or it doesn't affect you, there's another problem. One of the side effects of these drugs is acid reflux. That's literally when the stomach acid will come up into your esophagus and sometimes enter your mouth. Now, stomach acid is very, very acidic. It's similar to battery acid. So having that pH in your mouth cannot be good. And on top of acid reflux, common side effects are also nausea and vomiting. Actually, in the original clinical trials for Ozempic, roughly 20% of patients on the 1 milligram dose reported nausea, and 9% reported throwing up. Now, your enamel will start to dissolve at a pH of 5.5. And if your stomach acid is a pH of like 2, similar to battery acid, you can see that this can do a lot of damage to our teeth. And usually we can spot when it's related to nausea, vomiting, or acid reflux because the stomach acid doesn't really go on the front of the teeth, it goes on the back of the teeth. So a lot of times we'll see these dissolved tooth structure on the back of the teeth. On the front, everything might look fine, but then when you look at the back, when you put a mirror on the back of these teeth or you take a picture, you'll see a lot of damage to the back of these teeth. Now, side note, if this happens to you, if you like start throwing up or you have nausea, vomiting, or you feel this acid reflux and you want to brush your teeth to clean everything, it makes sense, but that's probably going to cause more damage because right when your stomach acid is entering your mouth and your mouth is really acidic, your teeth are in a weakened state. So if you start scrubbing them with the toothbrush, they're actually going to start dissolving more. So what you need to do is at least wait like 30 minutes, maybe rinse your mouth with water, and hopefully allow your saliva time to build up and neutralize that pH, and then you can brush your teeth. Okay, now I want to talk about the third part, the part that everybody really talks about with Ozempic face is that sunken face look. Most people think like, yeah, if you have rapid fat loss, you're gonna have this sunken face. And yeah, part of that's true. When you lose a lot of fat, a lot of that fat's gonna be lost from your face too, so your face is gonna change. But there's also something else that not many people talk about. You also have lean tissue loss. This includes muscle and bone. There's a systematic review that came out in 2025 in the Aesthetic Surgery Journal Open Forum. What they found is that these GLP-1 drugs hit the facial structure in a really specific pattern. First, you get that temporal hollowing, you get that mid-face deflation, then you get periorbital or around your eye hollowing, and then your jawline collapses. And this is very consistent across patients. And the American Academy of Facial Plastic and Reconstructive Surgery reported a 50% increase in facial fat grafting procedures in 2024. So essentially, people are paying money out of pocket to put fat back on their face. Now here's the part that connects to dentistry. There's a 2024 Harvard review in the journal Metabolism. They describe that with these weight loss drugs, over 25% of the total weight loss typically comes from fat-free mass. That includes skeletal muscle and that includes bone. Now, does that mean that Ozempic definitely causes your bone loss? No, there's no specific study looking at the jawbone and how your jawbone gets lost from Ozempic. There might be a study later, but not right now. But what we do know is your jawbone is just like the rest of your bone. It is your skeleton. So if you have systemic loss of your bone, it doesn't skip the bone loss in your jaw. So if you see someone on these GLP drugs and their jawbone looks kind of sunken, that bone loss could be at least a small part of it. So if you're on one of these medications, what can you do? Well, first thing is tell your dentist that you're on this medication and they'll look out for any signs and see if there's anything going on with your teeth, any risk of cavities or anything like that. You can also try different saliva substitutes to at least help and make up for that loss of saliva. So one of them is like biotin. There's actually a bunch of different products now for this. You can also try chewing gum, specifically in between meals. So I like something that has xylitol in it. Xylitol is the only sugar substitute that actually prevents cavities. So this will help counteract some of the other problems. And so you're gonna get the benefit from the xylitol. But the other thing that chewing gum does is anytime you chew anything, it produces saliva naturally. So it's gonna help increase that saliva. It's gonna help keep everything clean, and you're gonna get that bonus from the xylitol. And also, if you are on Ozempic, you should still be working out, like doing some resistance training, and make sure you're getting enough protein, because yes, you're losing a lot of fat, but if you're losing some muscle too, this can still cause problems. And again, one last time, I am not anti-Ozempic. If you're on Ozempic and watching this, I'm not telling you to stop. If it's working for you and you're happy taking it, keep taking it. I just want you to know some of the side effects. Anyways, thank you guys for watching. I hope you liked that video. If you haven't already, hit that thumbs up button and subscribe to my channel below, and I will see you in the next video. A few years back, Demi Moore went on Jimmy Fallon and said that her 2 front teeth got knocked out. The headlines all said the same thing. It was because of stress. Stress knocked her teeth out. But here's the thing, that's not exactly what happened, because it really doesn't make sense that someone gets really stressed out and then all of a sudden they lose their teeth. But Demi actually told us exactly